It has been just over 3 years since the World Health Organization declared COVID-19 a global pandemic.
Well, since then, more than 6.8 million people around the world have died because of the virus. The pandemic shifted lives for billions around the globe. Here in the U.S., business owners were forced to find ways to adapt. Those who were unable to closed their doors. For more, let's bring in our panel of guests. Dr. Angela Mills is an emergency care physician at New York Presbyterian and chair of the Department of Emergency Medicine at Columbia University Irving Medical Center. Also joining us is Alexis Sweeney. She's the founder and owner of the Silhouette by Alexis app and co-founder and co-owner of Coletta at Bad Habit Ice Cream. Jessie Merchant Zuniga is here with us on set as well. Welcome, ladies. It's really great to talk to you all. Dr. Mills, I want to start with you because you really are the definition of a frontline worker. You are someone who was there, who worked throughout the pandemic in emergency services. And I wonder how the coronavirus shifted the way that you work.
You know, it really changed everything. It changed healthcare. I think it changed individual physicians, our staff members, just the way we approach our patients and the world right now. It has shifted us. Even some of the ways we practice are very different now. I think we're in a much better place, thankfully, now with vaccines and development of lots of medications. So the way we take care of patients with COVID is very different.
Work changed for everybody, for you as well, Alexis. Tell us about the transition to virtual and the launch of a platform for fitness.
Yeah, you know, it's crazy. 2019, I was running around New York City teaching anywhere from 18 to 25 classes a week. And so I had this idea of launching a platform that really spoke to loving your body, taking the workout beyond the physical benefits to the mental. So January 2020, I launched a bare bones website. March 2020, I had an influx of people just asking me, where can I find you? Where are you teaching? I need to escape. I can't leave my house. I need a break from my partner. I need a break from my kids. And so the platform quickly emerged into an iOS, Google app. And then I started teaching Zoom classes because I found people wanted that connection and they wanted to be seen, they wanted to be heard, they wanted, like I said, to really not only reap the physical benefits, but the sense of community as well and be able to see other people's faces kind of going through it and struggling as well. So I quickly pivoted and scaled as fast as I could just to be able to bring the platform to as many people all over the world.
So you were doing group in-person classes prior to the pandemic.
Right.
So how was it different for you going from, I've never taught a fitness class, I imagine it's quite a thrill, right? I mean, you're like, it's like leading a lecture, but it's also physical. I mean, and you're a real leader of that group, right? You're getting people through it. How did it change for you professionally, that feeling you get from the work you do?
You know, I feed off of other people's energy 100%. And so for me, that's another reason why I had to start the Zoom platform, the live studio, because I can, even though it is virtual, even though you're looking at a bunch of tiny little boxes on the screen, you are speaking to these individuals and you are getting to know them. And we would always have coffee chats as well and just like share everyone's stories. And I mean, we were streaming in from Italy to France to all over New York and the States. So I really think we tried as best as I could to capture that essence of a live studio experience and bring that to a virtual platform.
Jessie, I want to turn to you. The restaurant industry was hit hard during the pandemic. I mean, I was just thinking about it. And even around here, around the broadcast center, the landscape has changed because restaurants that used to be open, that we used to go to, or bars, they're no longer here. And I wonder for you, how is it that you were actually able to expand when so many other food-based establishments were shutting their doors?
So I think obviously that was a very real reality for Manhattan and Brooklyn restaurants specifically, who do rely on their communities to enter regularly into their space. So things changed really drastically across hospitality in general. My partner and I, a year into COVID, though we were still lucky enough to still be working full-time as chefs, decided to start our own side project as Bad Habit Ice Creams we launched.
I like that name.
Thank you. Thank you.
Amazing.
Thank you. So we had a unique situation where, though we were also working full-time as chefs, we were doing ice cream production for wholesale and retail in our Brooklyn apartment. So through that lens, we had a really unique way to engage with customers through doing deliveries, interacting during pickups. Fast forward a year and a half, we just opened our first brick and mortar, and now we're seeing the, brick and mortar side of it, where we have guests able to enter into our space fully post-COVID and see how guests are re-emerging back into the restaurant scene, which is really exciting. I think everyone's really excited to have a space to go to, and we're really excited to have a space to welcome guests into.
Yeah. Dr. Mills, the question that people have for the whole entire public health establishment, for the medical world, for scientists, all of it is, are we better prepared for next time?
Yes. I would say back in March 2020, things were changing every day. There were new guidelines, new recommendations. Sometimes they'd change hourly. And so we really had to be very flexible. And along the way, we learned a lot of lessons. And I think, thankfully, we've taken those. We've been able to not only publish them and lecture on them and really keep catalog of all of those. And so just the way we were able to be innovative and resourceful. We use telehealth in new ways that we had never used before. And now that's a huge advantage to patients that prior to the pandemic, we're not really using telehealth. And now it's much more convenient, and patients can access care anytime right from their, from their homes. And I think just the way that even we keep supplies and stockpiling different things like ventilators and personal protective equipment, the hospitals really have been able to transform the way they do business.
Alexis, I want to ask you how things are going now. I mean, you've got some in-person classes, and I wonder what's next for your platform here moving forward, because it's interesting. I was recalling back to that early time when things first shut down. You were talking about the need for connection. I think that really was so strong. Sort of first and foremost in a lot of people's minds is, how can I be with people safely? What's it like now for you?
It's been a whirlwind for sure. And to be honest with you, Elena, I've just been trying to keep up with the growth. I'm a completely self-funded solo entrepreneur. And like I said, I quickly had to figure out how to become an app just to have that accessibility. So now we're about to be also on Fire Stick and also on Roku.
So you're a tech expert as well.
I have great people around me, and I'm surrounding myself with people smarter than me just to try to, on the tech side, scale as quick as possible, but also to, along with the live studio, I still teach Zoom classes every day, and I still meet people from all over the world, and they just want to be seen. People just want to be heard still. Like, that'll never go away. People want to reap the physical and mental benefits and really love their bodies. And I think that is something that will carry us through not only the pandemic, but going forward. So just trying to keep up.
And sometimes loving your body involves feeding it ice cream. Jessie, what have you learned from the pandemic that you're carrying forward and still kind of instituting or benefiting from today?
I think primarily respecting our original customers and the people who showed up for us during such a difficult time and really gave us the opportunity. It's thanks to them that we were able to open our first brick and mortar. So I think an expansion of grace through customer service and hospitality is key. I think that from a staff perspective, staff also more than ever needs to be heard, feel safe physically, emotionally, mentally, most of all. So I think those are things that we're really taking with us from the pandemic in terms of being leaders within our own space as well as to our customers.
Yeah. We are 3 years in, a little bit more, and I feel like we're just getting the distance now to assess what happened and how our lives will be different for the future. Dr. Angela Mills, Alexis Sweeney, and Jessie Merchant Zuniga, thank you very much for being here, all of you.
Thank you.
Thank you.